situation. In the past few days, we have seen a continuous increase in the number of local COVID-19 cases. In a moment, Dr. Chuang will give you an update. So the Center for Health Protection has been sparing no effort in their epidemiological investigation and contact tracing. They hope to find the source of infection as soon as possible. And then for the places where, or for buildings where the confirmed cases live, deep throat saliva specimen bottles have been distributed to residents in the block and nearby, because we want to find those who've been infected as soon as possible, and then we could help to prevent the disease from spreading in the community. Now, we are in a state of new normal, and whatever prevention and control measures we take, they must be targeted measures. The aim is to stop the spread of the disease, and where it's safe, we could also resume the necessary economic and social activities. So in the light of the latest epidemic developments, we're going to take the following prevention and control measures. Now, 2 days ago, I announced certain boundary control measures. Today, I'm going to focus on measures that will limit on social distancing. Now, with the latest risk assessment, we have seen in the recent cases, there are activities that involve not wearing a mask, and these are considered high-risk activities. So we need to, therefore, tighten certain social distancing measures. For eating establishments and scheduled premises, there will be a cap on the capacity, and there will be also measures to control the risk of cross-infection. Now, under CAP 599F, that is Prevention and Control of Disease Requirements and Directions, Business and Premises Regulation, we're going to tighten certain measures. From the 11th of July, that is Friday, midnight, the new directions will come into force for a period of 14 days until the 24th of July. The details are as follows. First of all, we will target catering businesses. Now, for catering premises, the number of customers must not exceed 60% of the allowed seating capacity, and there cannot be more than 8 persons per table. For restaurants or pubs, there cannot be more. For bars and pubs, there cannot be more than 4 persons per table. The other requirements also remain in force. For scheduled premises, where there are activities that will require not wearing masks, then for each facility or group or room, the maximum number of persons allowed would be reduced from 16 to 8. That includes fitness centers, party rooms, karaoke. For nightclubs, at any one time, the number of customers must not exceed the 60% of the permitted seating capacity. And then the number of persons per table will be reduced from 8 to 4. For cinemas and other live performance venues and places of public entertainment, no eating and drinking is allowed. We will continue to impose. We will continue to maintain other restrictions that apply to scheduled premises. As you see, just now, the measures I announced have to do with premises where masks may not be worn during certain activities. And if there are group activities and there is no wearing a mask, then there will be a high risk of cross-infection. Next, I'm going to talk about stepping up quarantine measures. Now we are going to, testing rather. We will be doing targeted testing. Staff of homes for the elderly and the disabled, staff of restaurants, and drivers of public transport. The aim is to identify asymptomatic patients so that we could achieve early detection, early isolation, and early treatment. And that way we could also break the transmission chain as soon as possible. We are going to support the work of the Social Welfare Department and the Transport Department and the catering industry, that we will arrange for private testing for the relevant groups. We will provide professional advice and support. Now, the government has always been adopting this suppress and lift strategy in devising our measures, but this doesn't mean we are letting down our guard. So here I would like to make several appeals. First of all, I would like to remind the public to maintain personal hygiene at all time, and they should wear a mask, especially in crowded places like on public transport. Now, I can see that in general, the public have been doing that pretty well. Everyone's wearing a mask. But when people are in eating establishments, when they are not actually eating, maybe people will not put on their mask. So we would like to appeal to the public, when you are not actually eating or drinking, you must still wear a mask in a restaurant. And it's best not to share a table with strangers. Yesterday, I heard Dr. Chuang Shuk-kwan mention that we should try to share a table only with family members or people we know. When we eat and so on, that will help to reduce the risk of infection. And as far as possible, maybe you can order takeout and you can eat at the office or at home. Now, the second appeal is to avoid going out as far as possible. And I know people have been, staying home for a long time in the past few months, and it's only recently that we have slowly resumed normal social activities and other activities. But because the epidemic remains in a state of flux, so we would like to appeal to the public to reduce, to avoid going out and avoid gatherings or dinner gatherings as far as possible. Because then you can limit the chance of you coming into contact with asymptomatic patients, because we know there are patients who are asymptomatic but who are actually infected. So if you reduce such activities, then there is a lower chance of coming into contact with asymptomatic patients, and that will help to reduce the risk of cluster infection. Now, if you don't feel well, especially if you have symptoms related to respiratory diseases such as cough, fever, and other upper respiratory infection symptoms, then even if the symptoms are mild, please go and see a doctor at once, and then the doctor will decide on a professional basis as to whether a test should be done. I noticed that in the past day or two, we've been doing tests in the community, the 18 Chinese traditional Chinese medicine clinics. I have seen that actually many more people have asked to do the test at the community level and in our clinic. So it seems that people are becoming more alert. So if you don't feel well, or if you are worried, or you believe that you may have had come into contact with close contacts of infected cases, now the Department of Health, of course, is still carrying out tracing work. But in the community, actually, we have these centers where tests could be done since May. We've been doing that since May. And my third appeal to the public is to operators of eating establishments and staff in these establishments. Now, you see, we're taking targeted measures. For this time round, we see there are clusters involving Chow Chan Teng, there's Hong Kong Style Cafe, and other restaurants. So we must remind operators and those working in the catering industry to follow the directions of CAP 599G, 599F rather. Now, and also 599G. Now, we are talking about reducing social contact. It's also about ensuring personal and environmental hygiene. Our directions must be enforced strictly. That is, between tables, there must be a distance of 1.5 meters, or there must be effective separation. Now, we see that when the FHD conducts inspection, in most cases, restaurants have been following these directions. But of course, sometimes you may have to offer an advice, and prosecutions have also been taken out. But we hope everyone will follow the directions. And when people are not eating, they should wear their mask. And before going into the premises, there must be a temperature check. And then hand sanitizer must be provided for people on the premises. These are measures that will help to reduce the risk of the transmission of COVID-19. Now, finally, COVID-19 is not going to vanish in the near future. So for different governments and people of different countries, we all have to coexist with the virus. So we will have to change our habits inevitably, and we have to accept this new normal. So we need to adapt to the new normal as we carry out social and economic activities. Now, of course, I have made an appeal just now. Let me make appeal again to the public. Please do observe personal and environmental hygiene, and please support the various prevention control measures of government, so we will work together to fight the epidemic. This is to protect yourself and protect your family members. At the same time, it is to protect our public healthcare system. As I said earlier on, now for our measures, we don't aim to achieve zero infection, but we want to contain the infection level within what the public healthcare system could cope with. Now, I will invite Dr. Chuang to give you an update on the COVID-19 cases, and Dr. Lau will also give you an update on the hospital authority. Thank you.
Ever since 4 p.m. until today, we have 42 confirmed cases. And the numbers are 1325 to 1366. For 8 of them, they are imported. And 3 persons are pilots. 2 pilots and another crew member were confirmed cases. So they are 1325, 54-year-old male, 1326, 42-year-old male. They are pilots, then they come back from Kazakhstan. And 1362 is a person working on the plane. So we are talking about cargo planes. And we have another pilot. He's also driving a cargo plane. That's 1333, 52-year-old male. And 1330 also comes back from Kazakhstan, a 3-month-old female baby. The father is 1318. It's another confirmed case. So the 3-month-old baby is also a confirmed case now. And there are 2 Filipino domestic helpers, 1328 and 1363. For 1328, 42-year-old female, 1363 female, 43 years old. They both come back on HX782 on the 8th of July. And for 1327 is a 52-year-old male, and he comes back from Pakistan on the 7th of July. So after they come back to Pakistan, they have been taken a deep throat saliva specimen, and they are now confirmed cases. And 32 cases are local cases. For 23 of them, they are related to the contact care for the age center. That's from 1334 to 1355. And 1360 is also related to the contact cluster. Many of them are asymptomatic. Some of them have mild fevers, and they will be sent to HA hospitals for quarantine and treatment. Other than this RCHE cases, there are 9 other cases that might be related to earlier cases. 3 of them are taxi drivers. 1329 is a 58-year-old male. He's a taxi driver. He drives night shifts. So at 1 or 2 a.m., he would go to Sunfat restaurants. He usually is alone. Sometimes he also talks to other customers. He lives in Song'an Estate, Onchong House. He shares his home with his wife and his daughter. And then it's 1356. He's also a taxi driver. He also works night shifts. He met case 1291, another taxi driver, on the 4th of July. And 1357 is also a taxi driver. He shares a taxi with 1291. He drives a day shift. When we contacted him, he's already sent to a quarantine center. But earlier on, he's given us a deep throat saliva sample. Now he's tested positive. And his wife and daughter, that is 1358 and 1359, they are also confirmed cases. 1361 is the wife of 1322. On the 4th of July, they went to Funky Congee and Noodle Foods. Another case is 1364. It's the foreign domestic helper of 1314. They both live at Highland Court, and 1314 was confirmed yesterday. This foreign domestic helper lives with that patient. As for two other patients, up to now we haven't identified the exact sources. That is 1365. He's male, 94 years old. He developed a fever on the 8th of July. He also vomited. He was sent to Queen Elizabeth Hospital by his family. He lives at Cheon Court on Hong House. He shares his home with his wife. Sometimes he would go to Chiwon-san Center. He would shop at the wet markets there, or he would just walk around in that neighborhood. But he hasn't gone to any specific places. As for 1366, it's a lady, 58 years old. She lives in Changsha-wan, Castle Peak Road, Wing Lung Building. She's not working at the moment. But she always takes taxis. So we are trying to find out whether she is related to other cases. So these are the cases that we have today. Up to 12 today, 783 cases have been reported. And now we have 222 patients that are still hospitalized for quarantine and treatment. In the past 24 hours, we have 9 patients that have recovered, and they were discharged from hospitals. Now we have 1,175 patients with confirmed or probable infections, and they have been discharged. And up to 12 noon today, we have 149 confirmed patients, and they are in 8 hospitals, and 2 of them are in critical conditions. They are 595 and 1315. 2 are in serious conditions, and their numbers are 1269 and 1306. And for the remaining 145 patients, they are in stable conditions. And up to 9 a.m. this morning, the hospital authority has opened 1,148 negative pressure beds, and the utilization rate is 58%. As for negative pressure was 559, utilization rate 65%. Well, we have ambulatory hospitals for the elderly, and now I would like to give you some information. As for our psychiatric day hospital and elderly day hospitals, from today onwards, they will suspend their services. And from today onwards, we have already suspended the visitation arrangements for some special hospitals. Now, we will be paying close attention to the developments of the epidemic, and we will be making adjustments to the provision of services. We hope to minimize the flow of people in hospitals so as to reduce the risk of infection. We understand that such measures may cause inconvenience to certain patients. We hope that you can understand our arrangements. Thank you. Now it's time for the press to ask questions. Please tell us your institution and your name, and please do not ask more than 3 questions. This gentleman here. I'm from cable TV. I would like to ask about examinations and tests. And how many tests are we doing per day in Hong Kong? Professor Yuen Kwok Yong hopes that 7,500 tests can be conducted per day. So he's been talking about that for several months. Can we do that now? Do we have enough resources or manpower? And when can we achieve the goal of 7,500? And for these tests, would they also be conducted at elderly homes? Will you distribute bottles to RCHEs so that they can do tests anytime they want? Another question for Dr. Cheung. It is said that the viral load of patients are quite high. So has the virus mutated? Why has the viral load been so high? So now is the most serious situation ever since January. Why is that? Now, the book fair will be opening soon. Will CHP ask the book fair to implement certain measures so as to minimize the risk of infection? And also for the Kong Tai elderly home, how many residents are living there and how many staff? And how many of them have been confirmed with the disease? As for testing, all along, it has been very important when it comes to the prevention and control of epidemics. Now, ever since the epidemic started and up to now, we have been expanding our scope of testing, and we have been enhancing our testing capacity. And there are 2 areas. First, we are talking about the capacity, that is how many tests can be conducted per day. And secondly, how can we ensure that we can expand the scope so that we can have a clearer understanding of what's happening in the community. Well, if there are asymptomatic patients or cryptic patients, if we expand the scope, then we can find them. So when it comes to the scope of tests, our original goal was to prevent and control the epidemic. We did it in hospitals, and we also conducted tests on close contacts. But from February and March onwards, we started to conduct it in the community because we know that there are asymptomatic patients in the community. So at the HA's general outpatient clinics, we have been doing this, and we have been calling on private doctors to help us because we discovered that there were many infected people that went to see private doctors. And lately, we've expanded to the airport. Now, for example, we have a lot of imported cases. So at the airports, from April onwards, we have been testing 100% of the inbound visitors. They all have to take the deep throat saliva test, and they have to wait for the results because they are allowed to go home. And in May and June, we further expanded our testing scope. So it's upgraded from tier 1 to 6. 6 is airports, and then now it's 7 and 8. So what are 7 and 8? We know that there are high-risk clusters, and some are asymptomatic. So at different locations, we've been distributing specimen bottles, including the 18 traditional Chinese medicine clinics. And we know that for RCHEs, they are high-risk places. So for the staff of RCHE, we have been distributing specimen bottles to them. And at our district health centers, as well as other centers, we have been distributing bottles. That is our tier 7 testing. The HA has also stepped up its efforts. For example, at some institutions, for example, those with mental patients, they are also high-risk clusters, so we are also targeting them. Even though they are asymptomatic or they only have a few symptoms, we will try our best to test them. So we have been expanding our scope of testing so that we have a clearer picture of the epidemic situation. As for the Tier 7 that I mentioned just now, that is at a community level, we are doing this test on asymptomatic patients or patients with only a very mild symptoms. In May and June, we have conducted 9,000 tests, and there was no confirmed case. Of course, we can do more, but if the epidemic situation fluctuates, we have to reserve certain capacity so that we can handle an outbreak or if there is a huge number of close contacts. As for the testing capacity, we have been trying our best to enhance it. I can give you some figures. In March and April, there were a lot of cases. And each month, we conducted 66,000 cases. And in May, 71,100. In June, 109,388. As for the number of tests per day, yesterday we did over 7,000 tests. So this is the present situation, and on the day before yesterday, more than 6,000 tests. In the coming few days, the tests done per day will be more than 7,000. In the long run, our testing capacity will be high because a few months ago we already knew that we have to enhance this capacity. So from the anti-epidemic fund, we got $100 million for public laboratories, the Department of Health, and the 2 universities, so that their testing capacities can be enhanced. Some new machines have arrived already. You asked us what kind of difficulties we face. Well, we need to have enough machines. We need to have professionals, and we also need places for these tests to be conducted. So now at the Children's Hospital, we have some new machines arrived, and for the 2 universities, they will continue to step up their efforts. In the coming months or at the end of this month, we hope that we can enhance our capacity by 2,400. And normally now we can conduct 7,500 tests per day. Dr. Zhang?
Now, including the cases today, there are 28 confirmed cases for the elderly home, for the residents of the home. Now, has there been mutation of the virus? I think we have to ask the virologists and epidemiologists to look, or microbiologists to look at that. Now, we know that the TB614 mutation, but whether it's related to the severity of the disease or not, it doesn't seem that relevant, but we have to wait for new research findings. Now, just today, we have over 40 new cases. So, yes, I would say it's probably is a single-day high. 28 plus 4 over how many? Well, including the full-time and part-time staff, there are 18 staff members and 37 residents. What about the book fair? Well, I know there are, infectious disease experts. They're going to give advice on infection control. Now, of course, if there are more people going there, there will be a high risk of infection. The gentleman in a shirt, please. I'm from Now TV. Dr. Chuang, 1356 and 1357. What is the age of the 2 taxi drivers? And then another question for the Secretary. Now, can you still implement a health code? Because many groups are still pushing the government to launch the health code, but is it the right time to do so? What is the latest development? And then Professor Yun said that probably because you relax certain measures before Father's Day and it's not scientifically based. For example, outdoor there's a limit, but indoor there's no limit. Now, just now, the Secretary said we should accept the new normal. You just find the excuse for the new wave of transmission. Do you give the impression that you're being irresponsible in saying so? First, 1356 and 1357, male 65 and male 70 years old. Now, your first question on health code. It is a tool. The health code is a tool. That is, say, on under the mechanism of joint prevention and control with Guangdong province and Macau, and then we decide to open up our borders in a gradual manner when the epidemic is stable. Well, then we still need to put in place certain conditions. This can be unconditional reopening of the border. So that's why there's need for tests to be done, and the test result must be negative. And that's why we have a health code. The health code will mean that someone's tested negative for the virus. And so it's about public health control. It's about mutual recognition of a health code. Well, actually, we are all almost, done with that task, and there is no major problem there. But then it must be for the free places to decide together. Is now the time to open up the borders before we can do it. The Food and Health Bureau, rather and we've been in discussion with the other authorities under the mechanism of joint prevention and control. Now, of course, there is changes in the epidemic situation, and we've seen local cases. And under the joint prevention and control mechanism, well, then we have to see what we agree to do to take things forward. Now, you said that I mentioned is a new normal, but I'm not being irresponsible. The World Health Organization and many experts have said that before we have a vaccine or an effective treatment protocol, this virus is not going to go away. It's going to coexist with us. I think we've been talking about that for a long time now. It's just that under the new normal, as I said earlier, we had stringent social distancing measures, but then as the epidemic stabilized, we relaxed those measures. So we've been adopting a suppress and lift strategy. And that doesn't mean that we will let down our guard with this strategy. So that's why we keep reminding the public and the various industries that under the new normal, we have to strike a balance between economic activities and the needs of the public, and resumption of normal activities, and prevention of the disease. So because we want to carry on life as usual. But and that's why I've made several appeals to the public just now. We need the cooperation of the public. Now, we are seeing many more local cases. The Center for Health Protection is working very hard to try to trace the source of infection. And as they do so, we need to tighten our measures again at once. So that's why earlier on I announced that we'll be tightening up certain social distancing measures. So this is in line with our suppress and lift strategy. Now, we are therefore, implementing different social distancing measures. So you have to accept that. Now, when the epidemic stabilizes, we'll relax the measures. But if the epidemic becomes worse, then we have to tighten down measures. And that is an important indication of new normal. We keep talking about new normal. All along, the epidemic has been stable. But now, under the new normal, there could be change in the epidemic situation. And it's not just about Hong Kong. You look at South Korea, Japan, and other places like Australia, you see that when they relaxed certain social distancing measures, or when it was necessary to resume certain economic activities, social activities and other activities, you see there would be fluctuation in the epidemic. So what is important is that we have to learn to accept that. But what is important is when there are any changes, we are able to respond quickly in dealing with the situation.
Hi, from SCMP. First, regarding the guidelines on elderly homes. So, did the involved elderly homes violate any current rules by the CHP, as the rules amended as of July 3 said that staff should not be shared among different elderly homes? Should this regulation be tightened, or will it be tightened in the future? And then second of all is about the taxi clusters. Are there any other new rules that will be imposed on public transport, given that this is a concern concerning the public and everyone uses this? What should citizens consider, and how are you tracing this taxi cluster right now? Third of all is about social distancing. So the table per person limit has been tightened again. However, in restaurants like cha-chan-tangs or congee shops, it's rare that people sit at large groups of 8. Is it possible that this seating ban may be ineffective in containing the spread? And then another question about the testing capacity right now. Why doesn't the government leverage private labs to conduct more testing?
Okay, thank you for your question. Perhaps I'll answer the social distancing question and also the testing capacity. And I invite Dr. Zhang to give you more information about the CHP rule on the elderly and also the contact tracing of the taxi clusters. Now, as far as the social distancing is concerned, as I've said, due to the suppress and lift strategy, now it is a time for us to suppress. And the focus of the suppression is really on mask-off activities. So we understand especially from the recent clusters and also confirmed cases that a number of them are from catering business. You are right about the cha-chan-tang and smaller catering business. So we have very quickly, the Food and Environmental Hygiene Department have very quickly do more checking on these smaller catering businesses, and also issue letters to them to remind them, not only the customers but actually the operators of these smaller catering businesses to actually take on the infection control and also public health measures that we have recommended. Of course, we have now downsized the number from no limit to 8 people. So this is a suppression. This is a tightening measure. But as far as the smaller businesses is concerned, perhaps the table, would not be able to take 8 persons. But then they should have these safe partition between them, so that different people would not be able to, when they're masked off, when they are eating, that they would not be that they would actually, if there are partitions, then the risk of transmitting or transmission of if they have the virus, then it will be lessened. As far as the testing capacity is concerned, earlier I have already given an overview of the testing issues. One is that we have been, this is a top priority in the Food and Health Bureau and also the Department of Health and also the Hospital Authority to test, to provide tests to not only for outbreak investigation and also for the confirmed cases, for the prevention and control measures, but also recently to tap into the community to do more community surveillance. Not only for the symptomatic, the mild symptomatic, but as well as the high-risk asymptomatic groups. So we have been expanding, our testing areas. But then as far as the testing capacity, the numbers is concerned, that is how many tests that we can do every day. In fact, the numbers has been increasing in the past months. If I have just now quote the numbers given to you, that actually in March we have March and April over 66,000 number of tests, and then the test has been increasing from, for example, in May is 75,000, and in June is over 100,000. So you can see the number of tests has been increasing, and in the last few days we have actually exceed the number 7,500. In fact, yesterday is 7,800. So at times of emergency, that we will be of course, the public health laboratory and the hospital authority staff, they have been working day and night in terms of ramping up the testing for the outbreak control. But we have not stopped our community surveillance. Since, I think, May, we have started our community surveillance, what we call the Tier 7 in terms of the test. We have tested over 9,000 people, and all of them are negative, let alone the other tiers that I don't want to belabor here. So in terms of the testing capacity numbers, we have also, I think a few months ago, we have already given the anti-epidemic fund to the Department of Health, as well as the University of Hong Kong and also the Chinese University of Hong Kong. So together, they are also ramping up the number of tests per day. I think in a few weeks, I think at the end of the month that the numbers will increase another additional 2,400, reaching the number of 7,500 on a daily basis. Of course, the private, there are private private labs and also hospitals that are offering tests as well. So obviously, there are other needs. For example, some companies that maybe the high-risk occupational groups, they may be using these private capacities to test. We do not, of course, preclude the possibility of extending and using more of the private labs. But of course, we note that there are many demand coming for the private laboratory testing capacity as well. So the Department of Health and the Food and Health Bureau have been working very hard in encouraging them and also facilitating, for example, their accreditation, and also encouraging them to ramp up the capacity in preparation for all the needs of testing, both in the prevention and control, as well as, for example, if the situation is stable, then people are already talking about travel bubble, health code, and all that. So those would be in need of the testing as well.
So are you asking the private sector to help?
Sorry?
Are you asking the private sector to
Of course, right now we have been working with them very closely in all fronts in terms of all the different testing, different testing for different purposes.
Yeah, for the taxi driver, we are aware that there are 5 or 6 so far taxi drivers are affected, and we will publish their taxi number in our website. But I understand most of the customers of the taxi will not remember what the taxi they took. So we are exploring with the telecommunication company to see whether we can search or find out those passengers who had took the taxi during a certain period of time. And also for those taxi drivers who are working in certain companies, a few selected companies, we are we'll contact trace all the other taxi drivers and distribute them bottles to see whether there are some other asymptomatic infections. So we call upon the taxi drivers who had visited Sanfat Cha Chan Tan and also the bungay. If they have visited the restaurants or they knew some have been in contact with some of the confirmed cases, do go to hospital if they have any symptoms, or they can, if they are asymptomatic, and they can write an email to us at bottle@dh.gov.hk. We'll send them bottles to test.
So the testing is not mandatory for all taxi drivers, it's voluntary still?
Yes, because you have to come forward. We won't know who are the taxi drivers. And also, I would like to take this opportunity to remind the general public, for those we are distributing bottles to them, either in the housing estate or we are sending out to them, do write your telephone number clearly so that we can contact you in case if they are positive, if they are tested positive. Otherwise, we won't be able to contact them.
好，下一條。
Next question.
Our guidelines for elderly homes, we advise avoid deploying staff to work in different RCHEs, but this is not regulations. I'm not sure if there are regulations promulgated by the Social Welfare Department. Yeah.
So will you tighten the rules?
We do not have rules.
好，下一條。
Next. I'm from Hong Kong 01, and I have several questions about your new strategies. As for the number of customers in restaurants, how come this is 60% of the time, not 50% as in the past? Why are there changes? And we have heard this since the evening before last, and now you're implementing this. So you have been delaying for several days. Why is that? Why didn't you do it at once? And experts have said that in 1 week's time, the number of cases may double. So you have been delaying. So maybe that's the cause of the increase in cases. And for the book fair, will it be suspended? And also for the theme parks, will they be suspended, or that's just a limitation on the number of visitors? Can you make sure that people would keep a distance from other people? Otherwise, there may be a lot of risk at the theme parks and the book fair. And also for restaurants and taxi drivers, you're saying that you will do more tests. So actually, what will you do? Will you be doing random checks? Do you ask them to voluntarily do so? Do you have a goal? Now, for each restaurant, or for the taxi industry, how many percent of their members have to be tested? 2 days ago, I already said that if we have local cases, then this would sound the alarm. I've said that the virus won't go away. So under this new normal, we have to adopt this suppress and lift strategy. I have already said that our direction is tightening our measures. I don't think it is late. You can see that the CHP has been doing a lot of tracing. And when they trace the contacts, we find out directions. It seems that there are clusters that are related to Bungay and Sunfat restaurants. And also there is also a taxi driver cluster. So all these have given us more information so that we can review whether our social distancing measures are efficient and how much should we tighten them. And now when we look at the overall situation, we have to target certain areas for activities wherein people do not wear masks, they are of higher risk. So why there are restaurant clusters? Because, well, in a restaurant, you may sit close to each other and you take off your masks to eat. And after eating, you may not redon your mask. So we have to pay attention to all these. And that's why I've made several appeals. And now we are reducing from 80% to 60%. We will continue to review the situation, and we will monitor the developments. And this will last for 14 days. But if there are changes in the coming days, we would make adjustments anytime because we are adopting the suppress and lift strategy. How about the book fair? Is it low-risk activity? Well, for this outbreak, we can see that it involves activities wherein people take off their masks. A lot of experts have said that these kind of activities are of higher risk. That is when people take off their masks. And if there are activities in which you wear your masks, even though the number of people gathering is not that small, the risk is not that high, according to certain experts. So because of this, now we are looking at public activities, and if the situation is favorable, then of course we can relax our measures. But now we will have to implement certain measures under 599 Chapter 599G. Well, in certain activities, wearing a mask is very important. Other than wearing masks, I would call on you to keep social distance from other people. For example, the distance between two persons should be 1.5 meters. This does not change. We believe that by minimizing the number of people and by minimizing the capacity, these measures will be helpful. I'm sorry, the speaker is off mic. Tests. As for tests, now we are seeing clusters involving taxi drivers and restaurants. We need to target these clusters and do more tests in the community. Well, for drivers, we think they are at a higher risk, so we've been talking to bus companies. We have distributed bottles to bus companies already. So if the taxi drivers display symptoms, they can do the test. But for the tests we've done so far, the results are negative. And at that time, they were not that interested because the epidemic situation was more stable at that time. Now we want to target more on LCHE staff, restaurant staff, and public transport drivers. Of course, we will work with relevant bureaus and departments. Well, for example, the Transport Department or the SWD. We will also be talking to the catering industry. Arrangements would be made for members of such industries so that their tests can be conducted by private laboratories. We will start this work right away. And for LCHEs, we have been monitoring them already. So now we will speed up our work. I'm from Stand News. I want to ask a question about the HA. We've seen that a large number of elderly are now confirmed. So have you made an assessment? Do they run higher risks or do they have more need for medical services? And I have a question for Dr. Zhang. Just now you talk about contact tracing of taxi drivers in English. Can you repeat it in Chinese? And it seems that it's quite difficult for you to trace the taxi passengers. And another question for the Secretary, that is about the gathering ban. Well, in the future, would you tighten the group gathering ban? And you also call on people not to share a table with strangers. But now this is quite common in restaurants. So other than calling on people to not do that, what can you do? Can you also clarify this point that is about the effective date? Is it the 10th of July or the 11th of July?
Taxis. Yes, Dr. Chuang first. We have about 5 or 6 taxi drivers that are confirmed cases, and there may be a few other preliminary positive cases, so that's a cause of concern because taxi drivers do very many different passengers, and passengers may not know which taxis they have taken. So we've asked the police to help. We approached them 2 days ago. Of course, it would take some time. And also, we would like to appeal to taxi drivers. Now, if you've been to a Sunfat restaurant or Bunki, Congee, noodle shop food, or if you know other colleagues who are confirmed cases, please pay attention to your own health condition. If you don't feel well, even if it's mild, go and see a doctor. Or if you don't have symptoms but you've been in contact with those restaurants, you can email us and we'll send you a bottle. Of course, it will take time for the bottle to reach you because there is a strong demand now. But anyway, if you don't feel well, please go and see a doctor at once. Don't wait for our specimen bottle. And then we're also trying to see if we could approach the telecommunication operators, and then they may be able to help us find some of the passengers, that the taxi drivers have served. And then for some taxi drivers, they may belong to a certain company. Maybe they don't just drive designated taxi. Maybe the taxi drivers would be driving different taxis, so we have to approach the owners of the taxi companies, and then 1 or 2 work for large taxi companies or they hire taxis, so we will also approach those companies. So everyone needs to stay alert. Now we have a sudden spike of cases. Usually, we would like to set and distribute specimen bottles to the buildings where the confirmed cases stay. But then now there is a large number of cases, so it will take longer for us to distribute bottles. So please be patient. If you live in the same building where there's been a confirmed case, or if you live in anywhere else, you don't feel well, please go and see a doctor as soon as possible. But if you don't feel unwell, please be patient and wait for us to distribute the bottles to you, but that will take a bit of time. Dr. Lau? Yes, of course, we have seen a large number of cases involving the elderly home. Dr. Huang said there are now 23 residents from the elderly home who tested positive, and so they need to go into a hospital. Now, our control center will look at the capacity of each hospital, and then patients will be sent to different hospitals accordingly. We want to make sure that each hospital is able to cope with the patients they take in. Now, if there is a relatively larger number of elderly patients, yes, there may be a stronger need for medical care, say intensive care unit facilities and so on. So we have to look at the ICU capacity and the number of negative pressure rooms in each hospital in arranging to send patients there. And then we will also deploy more staff to take care of the new confirmed cases in hospitals. As I said at the beginning, we're going to adjust non-emergency service. Starting from tomorrow, day geriatric and psychiatric hospitals will suspend service. On the one hand, we want to limit to stop elderly from going to a hospital setting, and then on the other, we could redeploy staff from these day hospitals to hospitals and take care of the new confirmed cases. And then we will also be doing more triage at the accident and emergency department, so we could therefore make sure suspected cases are tested. At the same time, we could free up negative pressure rooms for patients in need. We're going to increase the number of Tier 1 isolation beds. You know, for certain negative pressure beds, there was need for us to do annual checks, so they were taken out of service. So we will try to complete those annual checks as soon as possible, and in other cases we may defer the annual checks so that we will have enough beds to cope with patients. Now, if there are many patients being admitted to our healthcare system, then we may consider reopening some of the Tier 2 isolation beds. We have 400 to 500 such Tier 2 beds, and they could be, put into service again. And then we are also considering isolation facilities. We're making necessary preparation. We will draw up, back up a reserve list of staff, and we will do redeployment, and we will also procure equipment. We arrange for catering service and transportation service for our staff too. Of course, whatever we do, we have to also make sure we have proper infection control, such as the procurement of personal protection equipment, and even for bed linens and so on, there is a need for special arrangement. Now we'll have regard to the latest scientific evidence, and then we'll see who could go to community facilities, and we'll drop criteria, and we'll also make the arrangement. It's all about making advanced preparation. When necessary, then we could put in place all these facilities. Now, all these measures are to boost our capacity when there is a surge in the number of patients, so we could take care of them in a timely manner. Thank you. Now, on 599G, of course, we will continue to monitor the situation. At this point in time, we're going to maintain the relevant limits on the group gatherings under 599G. Now, you talk about strangers sharing a table. Well, we've made a strong appeal. First of all, everyone must wear a mask. And if you have to take off your mask to eat, please put it back on as soon as you finish eating. And second appeal is that don't share a table. And thirdly, take-out is a good option too. All these measures are to reduce the risk of infection. Of course, when people share a table, it has to be done on a voluntary basis, I'm sure. Now, usually when you go to a restaurant, if you know you may have to share a table with someone else, if you think that it's a bit too crowded, then maybe it's better if you just order take-out. Of course, it's not possible for us to ban sharing of tables and, as a regulation or a law. But then people, of course, appreciate the risk. If you have to share a table with someone and the table is crowded, well, we hope everyone will exercise self-discipline. On the effective date, it's actually the 11th of July. 11th of July. Last two questions. Here, the lady in black on the second row. Good afternoon. I'm from Oriental Daily. When do you expect to surrender Chongyuan Estate? And after you surrender Chongjiang Estate, you have less than 150 quarantine units. But then we are seeing a spike in cases. And for Penny Bay Quarantine Center, it won't be operational until next month, perhaps. So if you surrender Chongjiang Estate, do you have enough quarantine facilities for close contact of cases? Second question. The social distancing measure, when will it come into effect? Now, there are so many practitioners in the catering industry and public transport industry. How are you going to arrange for tests for them? Will the operators have to contact you, or do you contact them? And would it be mandatory? How many staff members are we talking about? Third question. Now, the secretary said we have to adopt a suppress and lift strategy, and it's a new normal. But then experts have said before, for the cap on 50 persons in a group gathering, there is no scientific basis whatsoever. So have you actually consulted the expert panels before you decided on a number? So have you been too careless in deciding a number, and is the Bureau responsible for this outbreak? Now, for 599G, what is the reason for not tightening the group gathering ban? What are the concerns? Thank you. First, on the quarantine facilities, we've actually stopped sending people to Chongjiang Estate for quarantine purpose. We have other quarantine centers that includes Lei Yunmun, Pat Hung, and Sai Kung Outdoor Recreation Center. And at the end, by the end of July, we hope. Well, we've actually talked to the Architectural Services Department. Hopefully, they could compress the program, and then they could give us the a new center sooner. Then we can make sure we have sufficient quarantine facilities. For the Penny Bay Quarantine Center, now if it could be completed a bit sooner than end of July, that we are talking about 700 to 800 units in addition to the existing units. And there are other measures we can take too now, because there is a local outbreak, and so we have more close contacts that have to be sent to quarantine centers. Actually, before this outbreak, people who were sent to quarantine centers were people who came back from high-risk areas. And I said 2 days ago, we are taking certain measures on boundary control points, so people will come back in an orderly manner. If everyone comes back at the same time, of course, it may actually overwhelm our quarantine facilities. So we are going to talk to to the consul generals or to the relevant associations, and hopefully they would come back to Hong Kong in an orderly manner. And then that may help to lessen the pressure on our quarantine facilities, especially given the latest outbreak. So we need to reserve more quarantine facilities for close contacts for now. Your second question is on testing. Well, we started community testing in May, as I said earlier. In March, we did over 60,000 tests. In May, we did over 70,000 tests. In May, there were very few confirmed cases. But why is it that in May, we did over 70,000 tests, and in June, we did more than 100,000 tests? Well, that's exactly because we have increased community testing. Well, yesterday, we did more than 7,500 tests. And we've been doing the same in the past few days. And now we're doing more targeted testing because we have seen these clusters. So we believe we need to do more testing for these targeted groups. And as you're right to point out just now, that we're talking about a large number of individuals. So even if we turn to private testing capacity, there is a limit, so we have to do it in an orderly manner. The relevant departments will be in discussion to see how we take this forward. So there may be need to set priorities. For 599G, as I said earlier, we need to keep monitoring the epidemic. The CHP will do contact tracing, and then there will be information. We have to review that information. And at this point in time, we will retain the current restrictions. Of course, at different time, different people will have different views on the group gathering ban. When we relaxed the ban, some said the ban was not relaxed enough. They wanted more relaxation, but now maybe they are wondering if we've gone too far with the relaxation. Maybe we need to tighten up the measure again. So we have to look at the overall risk assessment. And we believe at this point we can keep the current restriction. But it doesn't mean we will keep the current restriction forever, or we may not lift it forever. No, under the suppress and lift strategy, we'll keep reviewing the situation, and when there is a need, we will definitely make changes accordingly.
I'm sorry, the speaker's off mic. As I said just now, if we look at other countries, be it Japan or South Korea or other places, the government would have to balance between public interest and economic as well as social activities. So for these three things, we have to strike a balance among them. And if the epidemic is stable, people and different industries would expect the governments to relax certain measures. So earlier on, we've relaxed certain measures. But of course, some people would think that the relaxation was not enough. We should have done more. But we always have to strike a balance, and we have to ensure the safety of people. So when we relax measures, we would also look at overseas experiences, and even experts would give us advices. Well, experts always say that we cannot expect to have zero case in the near future. So this time around, we have to tighten our measures immediately. If you look at other countries, well, they have numerous new cases per day. They may not be tightening their measures. However, we have assessed our own risks, and at the present stage, we have to tighten some measures, and we will monitor the situation all the time. Now, for our suppress and lift strategy, we have been discussing with experts about it. So it's not just the CE's expert advisory panel. The CHP also has a team of experts who would give advices. I'm from Economic Journal. I want to ask about the contact care for the aged center. Well, on which floor do the confirmed patients live? So do all the residents have to be sent to quarantine? And also for the staff there. And case 1302 is an old gentleman. Where has he been to? And other than the Jockey Club FAB Center, is there another center for these residents? And it is said that the Department of Health has not been following up properly on the distribution of bottles. So can you tell us more about that? And this new gathering ban, you have not asked schools to suspend classes. So how serious would the situation be if you decide to ask schools to suspend classes. And for these new confirmed cases, do any of them involve students or school children's parents? And you also talked about Tier 1 and Tier 2 isolation beds. So what is the capacity of the HA? Do you have enough isolation beds? First of all, about the elderly home, as far as I understand, all the confirmed cases involve the lower floor. Yesterday, one of the staff members was doing cleaning on the second floor, but so far we haven't seen any confirmed case from the second floor. For the preliminary positive cases, one of them has a daughter who goes to Good Hope School, and the daughter doesn't show any symptoms. We will talk to the school. Yesterday, we also mentioned this. That is about the capacity of HA. Other than Tier 1 isolation beds, we have also implemented a number of measures. We hope that we do not need to send so many patients to Tier 1 isolation beds. So for all the HA isolation beds, we have over 1,200 under HA. If there are more patients, of course, there will be a more higher demand for Tier 1 beds, and then we need to use our Tier 2 beds. We have 400 to 500 of them. And for our AED, we have already set up our triage system, or triage system. So this would shorten the waiting time for patients. For existing beds and wards, if they cannot cope with the demand, we would consider using community quarantine facilities. We would be able to handle. Well, that's another new confirmed case. This person has 2 children. One of them goes to a secondary school, and another one goes to a primary school. It's Chen Sui-ji's secondary school and Ching Chong Primary School. Well, for certain premises, well, this time around, we are not closing any premises. Of course, it's after assessing the risks. We think that the present measures are already okay. In particular, we are targeting activities in which people do not wear masks, or premises where people do not wear masks. We'll continue to assess the risks, and if there is a need, of course, we will do that. However, for our present assessment, we think the existing measures or these measures that we are implementing are okay. And for the Education Bureau, it has been working very hard to implement many anti-epidemic measures. For example, everyone that goes into a school has to check his temperature, and students are asked to keep social distance from other people. And on campuses, good hygiene should be observed, and this is to protect the health of children, school children. And there is also a mechanism set up between the bureau and schools. So if there's a confirmed case, then in the school, of course, the school will suspend classes. The CHP would trace the contacts and carry out investigations, and it would also discuss with the school as to how to disinfect and clean the school. If there are close contacts, they cannot go back to the school. And I have noticed that contacts now would volunteer not to go back to schools. And for close contacts, they have to be quarantined. Schools would also implement relevant measures to follow up. Thank you. We will closely monitor the situation. I believe the Education Bureau would continue to do its work, and it will liaise with the CHP because now there is a notification mechanism. They are now discussing it. If there are close contacts now, they will be sent to quarantine centers immediately. And if there are confirmed cases in the school will suspend classes. It's Good Hope Primary School. Well, how many people in the elderly home have been tested? Do you have the numbers? And also for the exempted people at the airports, do you have the figures? How many people have been tested? I think Dr. Cheung can give you the latest figures. For example, about the elderly home. For the staff working there, for the staff working in elderly homes, we have tested about 3,000 staff members, and all of them are negative. As for the information concerning Kwang Tai, Dr. Cheung will answer the questions. Well, all the residents at Kwang Tai have been tested. As for the remaining 9, they are tested negative, 28 positive. I do not have the figures that you asked for. For Good Hope Primary School, is the student or the student's family? The student's family. The student doesn't display any symptoms. The father is a probable case. He's tested preliminary positive. I do not have all the information you need. Thank you. Not the students. It's the students' parents. That is confirmed.